Well, good evening, everyone. Hi, this is Dr. Ellithorpe. This is March 24th, Tuesday, 2026, 6 o'clock in the evening here in Southern California. And this is the end of my workday and my workout at the gym. And I'm just back in time for this YouTube. So I'm a little bit on the tired side. So anyway, I have these questions. We have the YouTube where if you go to tlcdoctors.com, you can get on our newsletter. There you can get notified when we're going to do these question and answer times. Also, you can get a link that way to type in a question. And then if you get it here, I think before 4 o'clock on Tuesdays, it'll be printed out for me. The other way to ask a question is to go on the chat if you're on YouTube and type in your question in the chat. The way we usually do this every Tuesday night is for educational purposes, not for personal management or anything like that. We're trying to make a mechanism for general questions about the approach to functional medicine, integrative medicine, complementary medicine, alternative medicine. I've been practicing 45 years, so I have multiple decades, almost a half century now, in familiarity with natural, functional lifestyle approaches to medicine while still practicing the best of standard Western medical care. So I can give you my opinion about your questions. This is not meant to be personal instruction or advice. If you are one of my patients asking me a question, I'm not going to give you instructions over the YouTube what to do. Rather, put your question into a telephone question or make a visit, and we'll get back to you specifically. But I'll certainly give you my thoughts and impressions about symptoms or concepts that you might have. We do this every Tuesday at 6 o'clock to 7 o'clock. I rarely miss, but occasionally I miss. And we are trying to do this as an outreach and a support to our family, our friends, our patients, and their relatives and friends. So if this is a blessing to you, if you're blessed with being able to ask a question off the cuff, then please share and hit the like button. That will improve circulation. We're not monetized or anything. I don't make any money doing this, but it is another resource that my patients have and for access about my thoughts on things. So just a moment. I'm going to get a little bit of a lip moisturizer. It's been a long day of talking. Since 8 a.m., I have been nonstop talking and caring for people. So I get a little dehydrated and have my water and do my weightlifting with my husband 3 times a week at the gym on the machines. We spend an hour there. And that has really helped me with every aspect of my 70s, getting older, my confidence with my strength, my balance, just my gait, the way I walk, the speed of my walk, and everything about my feeling healthier and stronger has improved with my weightlifting in the gym on the machines. All right, so we have questions here. I'm going to start with the questions because I don't see any live yet. When the lives start popping up, I will go ahead and start looking at the live questions that can be typed in. But the first question I have on the YouTube series is Sherry. Sherry says she's 71 years old and she is on the patch, a 0.075 patch, and she uses it twice a week, and she's on 200 milligrams oral progesterone every night. She's 128 pounds. And she asks if she wants to hear more about me taking a break during the month of hormones. She said she is a breast cancer survivor of 26 years. She was diagnosed in situ, 6 months of chemotherapy, 35 weeks of radiation, 5 years of tamoxifen, and 5 years of a postmenopausal inhibitor. So, what are my thoughts? In general, my thoughts are ductal carcinoma in situ is arguably questionable as a true diagnosis of breast cancer. Over the years, because her diagnosis is 26 years. So in 2000, she was diagnosed. With more time and experience in the field of oncology, and I'm not an oncologist, but over the many decades seeing these patients, it's been come to understand that ductal carcinoma in situ is not as considered risky or cancerous or potential for disease if it is caught in situ and then with a simple lumpectomy. And very often that alone, probably they'll do a single lymph node biopsy. If there's any involvement in the lymph node, then that changes the diagnosis to a more deeper spread. But if it's truly local, in one spot, ductal carcinoma in situ at the site, and the lumpectomy excision got it all. Very often, this is just a observation without much at all of any aggressive treatment, like she got a quarter century ago. Now, with that, I've been practicing now 45 years, and I would say in that period of time, I have countless number of patients, both with ductal carcinoma in situ and many other stages of having had breast cancer, from triple negative breast cancer all the way to stage 2 or 3s, that have been treated and managed by their oncologists, who have come to me, who have survived it, and they're having bone density loss, and they don't want to go on aggressive, risky drugs or have the risk of bone fractures, and they're losing their bone density. They are still trying to be sexually active. They're dry. Their memory, their sleep is upset. Their skin is very frail. And so, with informed consent and discussion with her oncologist for quality of life, we have shared natural hormone replacement therapy that is monitored along with her oncologist. I used to work with Dr. Tetoff, who Tetef. I think she has a replacement doctor because I think she just retired. But she would often see patients of mine. I had another oncologist, several that were willing to monitor patients who, with informed consent, made personal choices to resume natural bioidentical hormones that are monitored. And I cannot think of any case ever in my years of practicing that we've had some negative outcome from it, only benefits. I've never seen a recurrence that was felt to be generated due to resuming some natural bioidentical hormones balanced with both the estradiol and the progesterone. I cannot think of a single case. So instead, we see better sleep, better lifestyle, marital relationships, better vaginal mucosa, better bone densities, better memories, better skin integrity, better immune system, better cardiovascular protection, and the list goes on, because estrogen does many, many wonderful things. Again, I'm not an oncologist, but remember, all women have estrogen receptors on their cells and progesterone receptors on their cells. And so it's a good sign if you have estrogen and progesterone receptors. Those are much more manageable forms of breast cancer if the cell has not become so changed in its malignant degeneration that it doesn't have receptors anymore. Typically, my understanding is the most difficult to treat are the triple negative estrogen and progesterone negative cancers. They use the receptor site as a handle for some of their therapies for treatment, along with surgery, along with radiation and so forth, some immunotherapies now. And that is helpful in the long term outcome. And then we come alongside the oncologist management with our dietary, immune boosting, and nutritional support systems. And we've had very good, in general, outcomes. Therefore, when the woman is now uh, feeling confident and improved on her outcome, very often she'll start seeing the negative effects of having lost her estradiol and progesterone, and with these symptoms that are associated with breakdown of the tissues, the bones, and so forth, her memory, her immune system, she'll start asking, is it possible to resume this? And so it's kind of like working with your oncologist to determine whether they'll follow you or not. I've had some oncologists that said, if you use natural hormones, I don't want to follow you anymore. So we just recommend them to another oncologist who is willing to do their management as well as our helping them with informed consent for quality of life on these hormones. And we've had very good results and happier patients. So that is the direction that I would advise, especially in carcinoma in situ patients, where now it seems that those are actually not really considered the same category of risk as other deeper stages, 2, 3, 4, in their cancer diagnosis with spread. Although I've had all stages in which we have tried this natural therapy, and the general trend in my personal experience working with oncologists and the informed patient of many, many good, favorable results. There is a wonderful YouTube video to watch discussing these things, which is called FDA Expert Witness on Menopausal Hormone Replacement Therapy. FDA Expert Witness on Postmenopausal Hormone Replacement. It's a long title, but it's on the YouTube, and you're going to see the FDA panel, and you'll see many gynecologists, gyne oncologists are talking about natural hormones today now, and they're much more proactive in understanding this after all the decades that we have been doing it on our own. So I feel very comfortable, especially with ductal carcinoma in situ or all these in situ levels. So Sherry, hopefully that's a help to you knowing that. We're getting lots of live questions. Let's go to some of the live ones. It says here, Deborah says, what do you think about mammograms? I believe there's a new technology where there's no radiation. Well, that's referring to the MRI, magnetic resonant imaging, MRI. And yes, that is not really involving any radiation beam therapies. They usually do, though, have the dyes, the gadolinium dyes. And so, indeed, that may be a better direction to go. But I want to emphasize your lifestyle and ask the question, why haven't there been any significant reductions in the death rate? Our number one killer is heart disease, number two, and a close second, almost sometimes competing to almost overtake heart disease as the cause of death. Cancers are so significant in prevalence in the society that you have to ask the question, ever since the war on cancer was declared, I think in Nixon's presidency, where's the big improvement? Where's the big reduction? And there is none. I remember in the 70s when mammography came out, and I was just starting to enter into my medical training in the 1970s. It was supposed to be so great for early detection and prevention, and that would be the biggest step to reducing the death rate in women. And we have really not seen that at all. Um, so, how valuable is mammography when younger women who have more glandular, potentially younger breasts that have glands for a potential pregnancy? The mammography is not as good in determining any abnormality in the tissues when they're more glandular breasts. So that becomes very problematic in premenopausal women. So there's all kinds of arguments against the radiation, the compressive trauma, the glandular breasts, the lack of being confident that with all those glandular materials, they can really claim they're picking up things uniformly. So there are many questions about this, although the standard of care here in California is to recommend doing mammography annually. And we generally start women in their early 40s, around 40. If there's a high risk of this in family and parents, uh, then it might even be started earlier. Or if there's any physical exam or clinical finding of some unusual mass, of course, it would be started even in the 20s. The youngest I think I've seen is late teens where actual breast cancer was identified. So the question has to be, where's all the research in preventing it in the first place? And there isn't enough. Now, I believe personally, my personal opinion is that cancer is a mitochondrial metabolic disease, meaning the energy producing capacity of the breast cells or any cell in your body when it's disrupted by the corrupted standard American diet, high carb, uh, genetically modified, pesticide, glyphosated type of foods we eat, uh, high in insulin stimulation through the high fructose corn syrup content of it and in our uh, beverages, then you're asking the hormone insulin is stimulating the growth of tissue, intimal thickness of the blood vessels that leads to heart disease and growth of tumors and polyps. So I think it's been identified very clearly that the high carb, high fructose corn syrup, standard American diet that emphasizes stimulating the chronic release and hypersensitivity initially, and then eventually the insulin resistance of a high carbohydrate diet of the American system from gestation, because we're getting even infants with a epidemic of obesity in the newborn infants. So that is probably where the answer is, stimulating abnormal growth. So what do I think about these mammograms? I think they're a tool, but to call them and require them on medical boards as standard of care, I think we need to grow up and make an educated decision that annual mammography has not produced the prevention and breast cancer death reduction that we had all hoped that it would back in since the 70s, which is now some 50 plus, half a century of years. There are other things like ultrasound that would probably be better to use as baseline for younger women with more dense fibroglandular breasts, magnetic resonant imaging, MRIs of the breasts with or without contrast, self breast exams, getting women to get back on progesterone cyclically to help have a opposition to their estrogen production when they're younger women. Very often, if you are stressed, the follicle stimulating luteinizing hormones will be suppressed through cortisol, and we're living in very stressful times, more in younger women today than when I was in my teens in the 60s. So I'm going to suggest that all women might do well to take natural bioidentical progesterone creams day 15 through 25 of their menstrual cycles as an added prevention and have natural guarantee of progesterone from ovulation, which is inhibited through all this excessive birth control, and which therefore leads to unnatural hormone and estrogen dominant milieu, which of course estradiol is a natural growth promoting repair hormone in our body, but it helps build the lining of the uterus and many other aspects of our cellular tissues, helps men in many ways, helps sperm motility. So when we have these birth control and the stress cortisol inhibition of ovulation, we are setting ourselves up for abnormal hormone milieus that generate, I think, angry cellular metabolism, and then the cell itself wants to survive, and it will have a genetic code of survival and making itself produce its own blood supply and have vascular uh, factors for growth promoted. Like when we were a single-celled fertilized egg before that split to 2 cells, 4 cells, 8 cells, 16, 32, 64, 128 cells. We had no heart then or vascular system, but within the first 56 days of our being, we started to form, differentiate, and produce and reach out a vascular system to implant into the lining of the uterus and get the placenta started. And then our enzyme production, because the umbilical cord is right at the abdomen center there where the pancreas and liver is at. And these enzyme productions start around day 56. And it seems to be taught that that enzymatic production is an inhibitor of the uncontrolled placental growth to develop a blood supply for a growing baby. That's why I always insist that women who use natural hormone replacement therapy use systemic enzymes on an empty stomach every day, at least 3, that will provide systemic enzymes like our body had when we were first growing as infants to inhibit an uncontrolled placental invasion into the uterine wall, without which there's a rare gonatotropic cancer, which is felt to be due to lack of those enzymes produced around day 56 of our, or 6 weeks of our gestation. An abnormal lack of control of the invagination of the infant's vascular invasion to get oxygen and nutrients, but doesn't know how to stop and get the balance. Well, so that balance is enzymes, which has been taught since 1909. Dr. John Beard, 1909, the trophoblastic theory of cancer. All right, so I never bought into it being a purely genetic problem ever in my medical life, although there are gene SNPs and enzymes and signaling molecules, immune signaling molecules that are part of this whole complex picture, which genetically can be helpful and modifiable. But these other things need to be financed and discussed. And I'm glad to see it starting to happening right now in further research with more information and lack of censorship, which allows us to just openly discuss our experience and our feelings over the many decades of showing up to work and seeing dear people with these problems and talking about them openly. So hopefully that helps answer your question there, Deborah, about the mammograms and our opinion on that. Annette says, Hi, Dr. E. What are your thoughts on the shingles and the flu vaccines? Again, you have to ask the question, why are we taught to expect disease? When I'm probably one of the most stressed women who have worked nonstop for, I think I got my first full time job working at Elaine Boyd Critch Nursing Home for Retarded and Deformed Newborns to 18-year-olds at 12 years old. I was working full time. And then I don't think I've ever stopped working since I was 12. So if I'm 72, that means 60 years I've been working without vacation or breaks. So talk about stress. I can only praise God for his strength and his endurance in my life uh, because this idea that shingles and disease should be expected, uh, and we should prevent them with a vaccine rather than talking about enough vitamin C. We don't make as humans any vitamin C at all. And so we know that vitamin C is antiviral. And so I have, since age 16, been receiving chelation vitamin C high dose IVs. Uh, and I survived a terrible myocardial pan-myocarditis from Coxsackie virus. At least that's what I was told when I was 16 at uh, what was the name of that hospital in Elk Grove Village, Illinois? Anyway, I can't remember the name of the hospital anymore, but I was there 4 months on the cardiac ward with a dilated heart or something, irregular rhythms, so forth. So I've always taken extra vitamin C. My father in food research on the research team at Armor Foods always had me on a low carb, rich protein diet, building up my immune system. And by the time I got married at 17, and then I got into the military and passed the military physical exam for ROTC in college, I think I was 18, 19. I passed the physical after having been hospitalized at 16 for 4 months for a pan myocarditis. So I've seen miracles not only in myself, and I did receive chelation therapy. I received it from Dr. Ray Evers, who was the medical doctor who brought chelation therapy and the right of medical doctors to use their training and broad knowledge on pharmacokinetic and application to human beings, and having the right to do off-label prescription. Therefore, the cardiologists that attacked Dr. Ray Evers, they were silenced because Ray Evers brought this before Congress, and Congress authorized duly licensed medical physicians to prescribe off-label due to our training and experience with medications that we felt that were valuable, and to further the envelope of helping patients with thinking about how to help them with other medications. So EDTA chelation was one of the things that improved microcirculation, along with the extra vitamin C and vitamins that were in each infusion. And so within 2 years, I went from irregular heart rhythms, arrhythmias, I think AFib or SVT, and I went to pass the military physical to get into ROTC, worked all the days of my life and had babies and so forth. We have to understand that vaccines are taught with not enough understanding that the manufacturers are not liable for the bad side effects, harm potential that they can produce. And they're not clear about their statistical benefit in prevention. The so-called COVID vaccine, you were supposed to take it so that you don't spread the disease. Then they found out that it does not stop you from spreading the disease. Then you were told you were to take the so-called COVID vaccine because it would prevent you from serious disease, and they found out it did not, and you uh, did wind up having some uh, as frequent hospitalization and severity of disease. And then it was promoted that that so-called COVID vaccine would prevent you from, getting it in the first place, and very often you got it. And so we were told it was safe and effective on an experimental basis. The science was being hidden. Pfizer, in fact, would not release the research they had on it, and bound it up for 75 years until a Freedom of Information. I think that was put out by the lawyer Siri, Siri, is the name of he's the lawyer, the main lawyer for um, Del Bigtree on the Children's Health Defense, the Children's Health Defense.org. And they won the case, and the judge refused the 75-year hiding of the research from Pfizer. It was exposed. And the studies were dismal in trying to justify safety and efficacy. And so when you ask me, what do I think of a shingles and a flu vaccine, I think of the fact that we have what almost sounds like the mafia, where the business buys protection from the local government, the town councilmen, the mayor, the local judges, and on up now to Congress and the institutions that we thought were of ethical integrity. And this payoff of lobbyists for the massiveness of the industry has now purchased us a more like mafia system than anything that has truly worked preventatively. I know in my experience many patients who have come to me and they claim they have had these protectionary vaccines, and then they subsequently get the pneumonia or they get the shingles. Why don't we rather use high dose vitamin C? Like I said, I'm probably one of the most stressed women that have ever lived and worked. And I use this on a regular basis. At least monthly, I take a high dose vitamin C drip along with certain daily nutrients. The low carb diet. I always fast about 20 hours a day. I work out 3 times a week, weightlifting for an hour. I walk daily aerobically. And I have a sleep routine. I'm in bed. I have a good night's sleep. I'm always up at about 5-ish in the morning, in bed, ready to sleep at 9. All these things help our immune system, especially a low carb diet and intermittent fasting, along with vitamin D. I take extra vitamin C. I keep it here so that I feel at the end of the day, if I feel stressed, I'll just open up a capsule of my buffered vitamin C right into my mouth, and I'll let that kind of swirl around and then swallow it, so that I'm getting at least a few grams every day. Linus Pauling would always take 6 grams a day. I don't know how often he did the IV. He used to come to where I worked at Whitaker's Wellness Institute in Newport Beach on Birch Street. Julian Whitaker used to run the place. He was a doctor who was impressed with all this, and friends with Linus Pauling. And Linus Pauling lived remarkably. I think he was 97 when he died. Anyway, no, I don't recommend these. And if they are not liable for being sued for efficacy or side effect damages, and you can't sue them, then I wouldn't use them any more than I would buy a product from a company like a car or a airplane ride that isn't liable for their performance, where I could sue them if the car failed me and I got it in an accident and injured, or the airplane malfunction due to negligence, and I would sue them. So why would I use something from a company that's given indemnity? I want you to remember again that the Childhood Vaccine Safety Injury Act of 1986, signed by President Reagan, is exactly that. It's the National Childhood Safety uh, uh, Vaccine Injury Act, because it's an injury. That means the vaccines were known to cause injuries. And they gave them government protection with the mandate in that law, 1986, that the vaccine companies, the CDC, HHS, was to mandate every 2 years a report on its safety and efficacy. And there's never been a report on the safety and efficacy. And they couldn't produce it. And that's why Children's Health Defense, the lawyer Siri, was able to win the case, and it was kept suppressed by the controlled media. So you don't hear these things. So why wouldn't I say it's very much, or sounds like, in my opinion, a mafia with abnormal protection? So no shingles, no flu vaccines, is my opinion. I would rather see the money now go to building up health and find out why people like me, who are so stressed in work, are so healthy and not needing those things. I thank the Lord, my God, and my provider. All right, the next question is from M. Weldon. Dr. Ellithorpe, what is the best way to lower blood pressure and uric acid that does not affect your memory? It's doing weight resistance training 3 times a week on the machines, doing wall squats, where you do a wall squat and hold that position against the wall like you're seated without a chair under you. You hold it for a minute twice a day. And you cut out absolutely all fruit, high fructose corn syrup, juices, smoothies, all the high fructose corn syrup. If you look at the video called Sugar the Bitter Truth, around the 101 minute level, you'll see Dr. Lustig talk about the biochemical pathway, how fructose produces and turns into promoting uric acid formation. So they have shoved uric acid into our systems secretively, you might say. For so many decades, all of us have probably had 2 to 3 lifetimes worth of high fructose corn syrup in our body from any icing on a cake or ice cream or all the things we've had. So that system has been hurt, and you can recover it, but exercise and cut out all the fruit and smoothies and sodas and be low carb, don't eat late, and do that exercise. That's what I would say. That'll help your memory as well. And Weldon says, miss you. Miss you too, Michelle. God bless you and your family. Deborah says, why are so many regular doctors afraid of hormone replacement therapy? I don't think they love their patients. I'm not sure if they love their God, because it should be the love of their patients and God and taking care of such a great and mighty creation as a human being that would drive them to go home after a hard day's work and to look and study and open a book or look at some of the research on PubMed or the NIH research on this, or YouTube's on hormones, or read a book on it. There's a wonderful book called Estrogen Matters. And what is the name of that? Blooming. Avram Blooming, Bluming. He wrote the book Estrogen Matters, and all the many hundreds of reasons and biochemical value of natural bioidentical estrogen. And this paper that I'm reading here is hormone replacement therapy after breast cancer, is it time? And he does a retrospective meta-analysis of doctors like me who have done and used it and published their findings, although I personally not have published my findings, but there are many who have since the 1980s. And the conclusion is, in all of the publications, there was no increased risk of recurrence or death rate from hormone replacement therapy by using natural hormones. So I just think it is God, at least for me. And the reason why I became a doctor was not for fame and money, but it was to serve my faith in my Lord Jesus Christ and his creation with the Father and the Holy Spirit that drives me. I'll have a image of a patient that will come up. I believe that's the moving of the Holy Spirit indwelling us who believe in the death and resurrection of Jesus Christ. Just like the Holy Spirit came on Moses or came on David to prophesy or other people in the Old Testament, now we have, after Pentecost, the indwelling of the Holy Spirit. And I can't rest unless I look something up. And very often, I don't know how I find things or how things come to me, but I pray over my work, over my patients for wisdom and discernment. And so I love what I do, and I love God's creation. So why don't you ask each of your doctors when you see them, what is their worldview? What is their worldview operating? Because we all have one. Atheists have one, and all people have a worldview. But my Christian worldview is that we are made in the image of God, and being made in his image, we are like God, and we should understand the value of each human soul and to regard each human being as an awesome creation and not as an enemy. We're to love our neighbor as ourselves, and we're commanded to love our enemies, to feed them and to do good to them that despitefully use you and mock you. No, that's quite different than all other religions. And that's why I believe I have the right worldview. At least it keeps me always studying. It keeps me always at peace and gives me an understanding of why I do what I do, which is serving God, who is watching everything I do, and I'm serving him. So glory to him and all the wonderful things that have happened in my life. It helps me have a better marriage, to try and be a better mother. And I've certainly made terrible mistakes in my life, but it's happy to know that he paid for those mistakes. I could never work my way out of them. So ask them about their worldview. And if they say it's not your business, then say, okay, I'll find a doctor that is going to explain to me what drives them beyond money and prestige to treat me with more than fear of being sued. Okay. I see my patients as family. All right. Let's see. Met with an oncologist yesterday. Deborah goes on to say, after asking me why are they afraid of hormones? She met with an oncologist. She was not interested in at all the new research or anything. It made me feel shamed and said my mole could be estrogen positive. Well, Deborah, I don't know what to say other than we should treat human beings with love and have our boundaries, stand for righteous things, whatever's lovely, good, think on these things like Philippians 4:8 says. But I don't understand why she made you feel that way or he made you feel that way. And maybe you can find someone. I do think there's a revival coming. I think people are, I heard this one preacher say in my Bible studies I listened to them, and this one preacher said, make sure you preach the gospel or good news of the Bible always. And if necessary, use words. I thought, what do you mean, preach the gospel, good news, and then, if necessary, use words? And then I realized what he was saying is the way we behave, the way we handle our demeanor, the way we treat others should be a living testimony without our having to say a word. But if necessary, sometimes, like I'm declaring now, that is my basis of my whole being, a physician. That is my basis for my whole being as a physician. Anyway. All right, Debbie says, how do we keep from getting shingles in this stressful world? Lysine? Well, that's been used for many decades, Debbie. Lysine is an amino acid, and many times the real reason might be that we have been so marketed to eat sugar and high fructose corn syrup and tasty mouth entertainment foods that we have actually suppressed our immune system with all this sugar and fruit sugar and mouth entertaining foods rather than eating the good protein that builds our cell membranes, our white blood cell count. We have much research that shows sugar, starch, carbohydrate, fruit sugars typically are eaten way in excess by Americans. We've exported this type of horrible diet to the world largely through our sugar drinks. And that suppresses white blood cell function. And so if you're already starting the day with a sugary cereal and orange juice sugared up, then your immune system is going to be shocked for 8 hours at least. And that's what we do to our children and all that junk food and carbs and packaged, refined, barcode labeled food. No, we should be eating more protein, and that's maybe why lysine is showing up. If we ate higher protein, we'd have better immune system production, better immune function. Immunoglobulins are proteins. And so I think it is that reason, largely why we succumb to viruses more often and our immune system fails us. And that's why I think if we lived a low carb and exercising, non-entertainment for this hole in our mouth, but rather used it to repair our body, to be of service to God every day and our surroundings, we wouldn't be having this talk about vaccinations. Again, there's a wonderful book called Dissolving Illusions by Suzanne Humphreys. And in it, she just, as a undergraduate in physics, internal medicine medical school, nephrology subspecialty, she found that they were giving vaccines of flu to her kidney patients upon arrival to the ICU, and their health was declining as a result of that. So she stopped it, and they got better. And when the hospital administration found that out, they fired this very learned doctor, physician, researcher. She was at Stanford, and then she was at the East Coast prestigious hospital group. So she wrote this book called Dissolving Illusions, and she graphs out the research of all infectious diseases. And what really improved them was peace, nation to nation trade and progress, getting better diets, shipping oranges to London during the winter season, shipping healthier protein-rich products and animal products and to children, better pregnancies, electrical plumbing. The carpenter and the plumber did more for keeping people healthy and reducing communicable diseases, infectious diseases, through sanitation. We saw the decline in measles and smallpox, so forth, long before any vaccine could have been produced or had any worldwide impact. And that was after World War II, largely in the 40s, with better trade, peace, sanitation, productivity, and plumbing and sanitation. Beth says, to get a tooth implant, I would need to take amoxicillin for 10 days. What would you suggest to do to support the gut microbiome at this time? Probiotics before, during, after, what else? Thanks. Well, a very low carb diet. I would fast before the procedure, at least 18 to 20 hours. I would not eat anything for 24 hours afterwards. So that would be at least a day and a half of fasting, ramping up to and afterwards. I would do a high dose vitamin C drip. I would probably do it with the EDTA chelation. I would use Argentyn Silver, swish and swallow, gargle. I would use a toothbrush paste made of xylitol and hydroxyapatite. I would be extremely low carb to carnivore the week or two afterwards. I would use probiotics. We have the high dose probiotic 225, 225 billion a packet once a day in water. You drink it. Then after that, I would move to the probiotic 100, one a day until 2 months. And then I would taper down the third month and stay on probiotics every day. I never used the antibiotics for my dental work. And I was able to, with these measures personally and the high dose vitamin C drips, not have any problem. I don't know your personal situation. I don't know your health. I don't know your blood sugar. I know my blood sugars run in the 60s, 70s, and 80s. And I know my insulin is good and triglycerides and so forth. I know my lifestyle. So I have a very good immune system. I have a very good vitamin D, making sure I took at least 20,000 international units the week before my dental work, and I used it for a month thereafter, and then I dropped back down to 15,000 international units. That's what I did. I think we don't appreciate how damaging broad-spectrum antibiotics are. And I personally accepted the risk that if it didn't work, I was going to have more dental work and bone grafting or bone trouble. But I valued my immune system and my gut, and I took personal responsibility because no one has 100% answer for anyone. But at least if you do the antibiotics, please do those things to help your nutritional and immune system, and always stay well hydrated. I try and drink about 90 ounces of water every day, half your weight in ounces every day. So you know how much I weigh approximately when I say 90 ounces now. And last one is, that's right. Alexian Brothers Hospital in Illinois. That's right. Alexian Brothers Hospital. That's where I was in August of 1970, or 69. I can't remember, until December of 1969 or 70. 4 consecutive months. That's where I was. Alexian Brothers. That's right. All right, let's see what other questions I can get done here quickly. Patricia says, hello, Dr. E. What can you tell me about a condition called photophobia when you have extreme sensitivity to bright lights? I think I'd ask you, Patricia, do you have blue eyes? People with blue eyes tend to have more photophobia. People with migraines tend to have more photophobia. We don't really have an understanding of that. And we have light pollution, you might say, with this, what we call dirty LED light, which is not the natural full light spectrum, and I think it's showing up with more photosensitivity. Um, so I don't know what more to say about that. I'd have to look into that. That's all I can offer up to you. I know, don't use sunglasses inside. Try and use normal incandescent lights. I know in California they've banned them. That just shows you the mentality of the stupidity of this state uh, legislation. Lori says, do you see crossover between perimenopausal symptoms like frequent urinary tract infections, trauma recovery, and post-concussive syndrome? Yeah, and the reason is what are hormones? They're general contractors for repair and rebuilding. So if you had a concussion, your repair is going to be marginalized. Your connective tissue repair is going to be marginalized. Your skin is going to start wrinkling and sagging and so forth. Your urinary tract and vaginal tissues are going to droop, wrinkle, and become patulous and be more at risk for irritation. She goes on to ask, do you think people can have magnesium deficiency even though the lab results don't confirm it? Absolutely. The levels that they call normal are typically population averages. And the American diet and the American soil, with now government industrialized, subsidized farming, is corrupt. And it's usually monocrop therapies. No longer do we have hundreds of farmers whose family and fortune and descendants depend on that land being well cared for and rotated, and him smelling the ground and rubbing it between his hands and looking at its content and rotating things. Instead, the farmer is bought off and it becomes thousands of acres, and the mineral and nutrient density is now a fraction of what it used to be almost 100 years ago, where an orange today is maybe 1/7 of the nutritive density that it was in the 1940s and 50s. And that's because they've genetically modified everything. So it's just fun to eat, pretty to look at, sweet to the mouth. Who cares about its nutrition? So, yeah. So I think magnesium should certainly hit the top range, if not more. Let's see. Are there magnesium supplements that are not sold in stores that are easily absorbed and don't cause excessive stimulation and irritability? Well, it depends on what you're getting. Magnesium oxides are almost completely unabsorbed. If it says magnesium oxides, that's the cheapest, and I would say you only absorb 4 or 5% of it. So if it's a 250 milligram, you're only maybe getting 10, 15 milligrams out of that. If you wanted to have blood-brain barrier passage, you want magnesium threonine. If you want to be a bowel softener, loosener, magnesium citrate. If you want it to be a calming muscle relaxant, maybe magnesium glycinate. So you want amino acid chelates, preferably. They're far better absorbed. Leslie says, I'm your patient. I've been using estrogen and progesterone creams. We just switched to the 100 milligram pill, and I've had vaginal bleeding for about 5 days. Is this normal? Should I continue the pill? Leslie, send this question to me through the normal doctor channels. Call the office. I don't know the last name, so you'll have to initiate that action to contact me. But yes, if we change your hormones to a stronger oral to get higher levels, we will probably get a natural clean out of the lining of the uterine lining, and it will diminish over time and maybe not occur. It depends on if you're cyclical progesterone or if you're continuous progesterone. So please turn that into a question that goes directly to me medically in your chart, and identify yourself with your last name so we know who you are. And I will contact you and look over your levels and why we did what we did. Michelle says, my son is 39 and has severe knee pain in both knees. He's 6'3", 175 pounds. He got the Johnson & Johnson COVID vaccine in 2021. He felt really bad for 24 hours afterward, but then felt fine. The orthopedic doctor and rheumatologist don't know why he has so much pain and inflammation after MRI and blood tests. Does he need a detox for spike protein? I would do the SARS-CoV-2 semi-quantitative total antibodies for spike protein. That's LabCorp's 164090. Do that lab test and see what his antibody levels are. If they're over 3,000, then he's still producing from that 5-year-old vaccination active mRNA production of antibodies, and he's just constantly producing them. But you need to go to a functional doctor and have that addressed. And there are many ways to do that with lifestyle changes, enzymes, IV chelation, vitamin C therapies that are very helpful. You have to find out his blood type. We have to look at his gut to see if there's inflammation in the lining of his gut as well. Damien says, greetings and blessings, Dr. Rita. Can a carnivore diet cause hormonal changes, such as vaginal spotting in postmenopausal women? Yeah, because the hormones are mostly based on steroid, cholesterol type backbone. And since there's rich cholesterol formation in all of the animal foods we're eating, you're going to have better support for maintaining your hormone levels. And yes, that can happen. So if you're the Damien I think you are, I know you are a patient, please send your call to me as a patient so I can directly look, find out your history, refamiliarize myself with your age and what you're on, and then contact you personally. So please, again, contact me. I think you're my patient or your doctor on that. Mickey says, I may have to take antibiotics for a red spot that my chiropractor says looks like cellulitis. I see my GP next week. Since chronic constipation has been a struggle for a couple of years, I'm concerned about my digestive tract. I'm 77. I eat high protein and cooked vegetables as well as fruit. I drink about 70, 80 ounces of water. How can I best recover? Mickey, I would have to ask the question, have you already started the antibiotics? I'm not sure that you needed it. You really should see your general practitioner. If that's a serious infection, and it is an infection, and then you have to start it, then you have to. But a very low carb diet and taking a high dose probiotic, usually of the gram positive bacteria, which are largely destroyed with the amoxicillin type antibiotic. That's what I would begin to do. But be sure to follow up with your general practitioner. Susanna says, hi, Dr. E. I was wondering what you think of the bone medication Reclast. Well, Reclast is a bisphosphate, and it's associated with osteonecrosis of the jaw, as well as atypical fractures in the femur. Do you ever put someone with pretty advanced osteoporosis on it for a year and then go off and see how they do, assuming they did the diet, supplement, weight bearing on the estrogen patch? Well, what about their vitamin D? What about their levels of their hormones? What is their inflammation factor of their sugars, their food allergies? Many things like this have to be addressed, Susanna. So find your doctor and go over that. I'm not a fan, and I've never had to use any of those bisphosphates, Reclast or Fosamax. Jennifer says, what are your thoughts on soy isoflavones for pain and inflammation? Well, they mimic estrogen behavior. They act as plant phytoestrogen, plant estrogens. And estrogen is a natural anti-inflammatory. So they have anti-inflammatory effects, and they do help with pain and inflammation. So that's what I can tell you about them. But if you can use the real thing, the natural estradiol, why not use that? Christina says, what do you know about hydroxy 7 or hydroxymidagrinine, hydroxy 7? That is a type of narcotic It has narcotic behaving uh, chemical features and is a dangerous thing to take. I would not use it. Uh, Denise says, how likely if past menopause is it for a woman to be anemic through an intestinal issue? Should one get a colonoscopy? Yes, I think I would get the colonoscopy, find out the cause of your anemia, and see your doctor. Usually it's not through something necessarily intestinal just because you're postmenopausal. Uh, there can be other issues such as irritable bowel, inflammatory bowel disease. Find out your blood type. Have a complete digestive stool analysis to look for inflammatory markers. All right, so I really went over. I lost my time here. It's 7:06. So I'm gonna end this long day and get some rest. If this was a blessing to you, please like and subscribe. Please hit the like button. That helps with circulation. And we'll see you next week here at 6 o'clock to 7 o'clock every Tuesday night. And the Lord bless and keep each of you and do the best you can to help one another do the best they can. And we'll all stay healthier and better longer. All right. Good night. God bless.